Hi, my name is Michael and I'm an acupuncturist on the acute pain service at Harborview Medical Center. In this video, I'm going to teach you an acupressure routine which you can do safely in your hospital bed, which may help reduce stress, anxiety, pain, as well as help improve your sleep. Acupressure is based on traditional Chinese medical techniques which have been found helpful to calm the nervous system. But please, if you find any discomfort while you're doing these techniques, please feel free to stop and ask someone for some additional help. Before starting these techniques, it is helpful to first focus on your breathing. Breathe in and out through your nose, slowly and deeply, into your lower belly. Breathe in to the count of 3 and breathe out to the count of 4. Just focus on making the out-breath a little bit longer than the in-breath. Breathing this way for a few minutes before you begin acupressure can often make the acupressure more effective. The first point is on the head and is called yin tong. It is located above the nose and between the eyebrows. Massage this point gently in a circular motion. Don't press too hard, but just with enough pressure, like you are checking if a piece of fruit is ripe. This point should feel comfortable when you are massaging it. Massage this point for 1 to 2 minutes or 5 to 8 cycles of breathing in order to receive its benefits. The next point is called Heart 8, and it is located on your palm, in the center of the palm towards the outside. To locate this point, bend your fingers till they're touching your palm. Where the little finger touches, right underneath, is where the point is located. You will press your thumb on top of the point and use the rest of your hand underneath the point to support it. You can then massage this point in a circular motion. Apply enough pressure to where you feel a dull, achy sensation, but one which is still comfortable. Massage the point this way for 1 to 2 minutes, or 5 to 8 cycles of breathing in order to receive its benefits. When you are done working on one side, you can switch hands and do the other side if you are able. The last point is located on the earlobe, and the way to find this point is to place your thumb on the back of your earlobe and your index finger on the front. And you're going to massage this point in a circular motion going away from the head towards the outside of the ear. Like with the other points, this point may feel like a dull, achy sensation when you press, but should still feel comfortable. Massage this point for 1 to 2 minutes, or 5 to 8 cycles of breathing in order to receive its benefits. When you're done working with one side, you can switch to the other ear if you are able. To finish your acupressure session, place your hands on your lower belly and feel the heat that is coming from your hands, and let the heat go deep into your lower belly. Breathe in the heat for a couple of minutes in order to help conclude the session. By now, you may be feeling pretty relaxed or a little bit sleepy, in which case you should let yourself rest. But consider doing this exercise once or twice a day while you're at the hospital and then at home in order to continue to receive the healing benefits. If you have any questions about acupressure and whether it's right for you, please contact an acupuncture staff member at Harborview for more assistance. Thank you.